So this is an example of a trauma patient assessment. Like always, BSI scene safety, and I'll make sure I check for general impression of both the scene and the patient. Because this is a trauma scenario, I will always assume that C-spine will be held or needed to be held. Because we have limited people, I will say in this case that we will have an imaginary person hold C-spine, but if necessary, and of course in real life, you would have someone real hold C-spine. So then, as always, I will check for their level of responsiveness using ABPU. If they're alert, verbal, responsive to painful stimuli, or unresponsive. I will check to make sure that ALS is called, because we're a non-transport unit, and I will have my secondary come take vitals. And that will be blood pressure, heart rate, respiratory rate. After that, I will move on to my primary assessment, in which I will check for XCAB, which are examinations, circulation, airway, and breathing. So for examinations, I will take my gloved hands, I will do a body sweep, look for any major bleeding, usually arterial bleeding. I will then check her circulation at 2 different points for rate, rhythm, force, and synchronization. I will also at this point check her skin condition for urticaria or cyanosis or anything like that. Then I will check and move on to check her airway patency. If she's able to speak to me, I can say that her airway is patent. If her airway is not patent, I will make sure to have airway maneuver done, and I will put an airway adjunct into her. For breathing, I will look, listen, and feel using the stethoscope to listen for lung sounds also. And based on her breathing, I will then administer oxygen. If the patient is in respiratory distress, I will use a non-rebreather mask. If the patient is unable to breathe for themselves or they're breathing way too much, I will use a bag valve mask. If the patient is in mild respiratory distress, I will use a nasal cannula just to kind of ease them. And then I will move on to my secondary assessment. And this is going to be DCAP BTLS is the head to toe assessment. D standing for deformities, C contusions, A abrasions, P penetrations, B burns, T tenderness, L lacerations, and S swelling. So head to toe, of course we're going to start the head. I will check her scalp for any bleeding with the gloved hand. I will check her face for any deformities or any bruising. Check behind their ears for vital signs. Check the raccoon eyes, signs of trauma. I will check her ears and her nose and eyes for any signs of cerebral spinal fluid. And if I see any signs, I will do a halo test to make sure it is or it isn't. Then I will move on to her neck. I will check